It gets the blood flowing vigorously to the area, preparing the muscles for intense activity. You won't typically find hacking used on sore, injured, or tense muscles that need to be relaxed. Instead, it's applied to large, fleshy muscle groups like the glutes, quads, or the upper trapezius in a targeted way. It can also help to loosen and break up congestion in the respiratory system when applied to the back over the lungs. It's a specialized technique that demonstrates the versatility of physiotherapy massage. It's not always about relaxation. Sometimes, it's about controlled, therapeutic stimulation to prime the body for performance. Let's talk about a technique that really gets in there and targets specific muscles. Picking up. As the name suggests, this technique involves lifting the muscle tissue away from the bone. The therapist uses their whole hand, or sometimes just their thumb and fingers, to grasp a muscle, lift it, squeeze it gently, and then release it. This is repeated in a rhythmic sequence along the length of the muscle belly. It's a form of petrissage, which is a category of techniques that involve kneading, squeezing, and rolling the muscles. The mechanical action of picking up has several important benefits. First, by lifting the muscle, you're creating space. You're separating it from the underlying bone and surrounding tissues, including the fascia. This can help to break down adhesions, those sticky spots where muscle and fascia have become stuck together, restricting movement and causing pain. The squeezing action then helps to pump blood through the muscle, delivering fresh oxygen and nutrients while simultaneously flushing out metabolic waste products like lactic acid. This technique is particularly effective for thick, dense muscles that are holding a lot of chronic tension, like the trapezius muscle in the upper back and shoulders or the calf muscles. It allows the therapist to isolate and work on a specific muscle without affecting the surrounding area as much. The lifting and rolling motion helps to realign the muscle fibers and release deep-seated knots, or trigger points. It's an intensive technique that can be uncomfortable for a moment, but the resulting release and increased mobility are well worth it. Ringing is another form of petrissage, but it adds a unique twisting motion to the mix. Imagine you're wringing out a wet towel. That's the essential action, but applied carefully and therapeutically to a muscle. The therapist places their hands on either side of the limb or muscle group, and then moves them in opposite directions, creating a twisting or shearing force through the tissue. The pressure is firm and applied as the hands slide over the skin, pulling the underlying muscle with them. This twisting action is fantastic for increasing circulation on a very deep level. The compression and torsion literally force stale blood and fluid out of the muscle, and when the pressure is released, fresh oxygenated blood rushes in to take its place. This vascular pump effect is incredibly efficient at nourishing the tissue and accelerating the healing process. It's particularly useful for improving the elasticity and mobility of large cylindrical muscle groups, like those in the arms and legs. Ringing does more than just move fluid around. The shearing force it creates helps to break down adhesions and scar tissue that run horizontally across the muscle fibers. Think of it as untangling knotted threads. By applying this controlled twist, the therapist can release restrictions that other, more linear techniques might miss. It also provides a significant stretch to the muscle and its associated fascia, helping to relieve stiffness and improve the overall range of motion in the limb. It's a dynamic and powerful technique for deep tissue release. Finally, we arrive at what is perhaps the most well-known massage technique of all, kneading. When you think of a deep tissue massage, this is probably the movement you picture. Kneading involves compressing the soft tissues against the underlying bone structure. It can be performed with the palms, thumbs, knuckles, or fingertips. The motion is circular and deep, designed to penetrate into the belly of the muscle. The therapist applies pressure in small circular movements, lifting and pressing the tissue rhythmically. The primary purpose of kneading is to address deep-seated tension, knots, and trigger points. The sustained circular pressure helps to mechanically break down adhesions and scar tissue within the muscle fibers. It increases muscle pliability, making them more flexible and less prone to injury. This technique is a workhorse for treating chronic pain conditions, postural strain, and muscle imbalances. By working deep into the muscle, a physiotherapist can release tension that has been building up for weeks, months, or even years. Beyond the mechanical effects, kneading has profound physiological benefits. The deep pressure stimulates a process called mechanotransduction, where mechanical force is converted into biochemical signals within the cells. This can help reduce inflammation and promote cellular repair. It also dramatically increases local circulation, bringing a rich supply of blood to the targeted area to fuel the healing process. While it can be intense, proper kneading shouldn't be excruciating. It's a therapeutic discomfort that leads to significant relief, restored movement, and healthier, more resilient muscles. So, there you have it. A deep dive into the science behind 6 of the most important massage techniques used in modern physiotherapy. From the gentle introduction of stroking and the fluid dynamics of effleurage to the stimulating percussion of hacking and the deep release of kneading, each movement has a specific evidence-based purpose. These techniques are fundamental in physiotherapy for promoting healing and relaxation. They are the tools a skilled therapist uses to reduce pain, improve circulation, release tension, and ultimately restore your body's natural function and movement. Understanding these techniques empowers you as a patient. Now you know that what might feel like a simple massage is actually a complex, targeted treatment designed specifically for your recovery. However, and this is the most important part, these are not techniques you should try to replicate at home without proper training. The effectiveness and safety of these methods depend entirely on the skill, knowledge, and anatomical understanding of a trained professional. They know the right amount of pressure, the correct direction, and which techniques are appropriate for your specific condition. That's why I always stress the importance of professional guidance. If you're dealing with pain, recovering from an injury, or just want to improve your physical well-being, I highly encourage you to consult a professional like the fantastic team at Dinesh Physiotherapy for personalized care. They can assess your unique situation and create a treatment plan that will get you back to feeling your best, safely and effectively. Thanks for watching, stay healthy, and I'll see you in the next video.